let's discuss about the meaning of contraceptive and the methods. So what do you mean by a contraceptive methods? Contraceptive methods are the birth control measures in which we are taken to prevent the unwanted pregnancies so that we can maintain the population under control. So the some commonly used contraceptive devices are condoms, IUDs, otherwise it is called the intrauterine devices, diaphragm, implant, etc. So the topic we are going to cover is conventional natural methods of contraception, barrier methods, intrauterine devices, oral contraceptives, injectable contraceptives, implants and surgical methods. So before going into the topic, we will see what are the features of an ideal contraceptive or how the contraceptive should behave. So an ideal contraceptives or birth control measures, it should have some features. We will see what are the features. So the contraceptive method should be user friendly. So it should be always easy to use. And also it should be affordable and easily available for all kind of peoples. It should be effective. In cases of failure, the failure should be very low and also reversible. It should not have any kind of side effect, but most of the contraceptive methods will be having some of the side effect, but the side effect should be very least. Also, there should not be any interference of the contraceptive with the sexual activity of the particular couples. So these are the features of an ideal contraceptive. So we will see what are the different kind of contraceptive. Before that, on the basis of reversibility, contraceptive methods are divided into two groups. One will be reversible methods and other will be irreversible methods. So in the reversible methods, the contraceptive methods can be reversed, which means whenever a woman want to conceive or whenever a woman want to attain the pregnancy, that will be called as reversible methods. It included barrier methods like intrauterine devices, chemical methods, implant, oral contraceptives, injectable contraceptives. So when a woman will start to not using these kind of methods, they can able to get pregnant again. That is called a reversible method. In the irreversible method, once it is done, the couples will not be able to produce the babies. So these contraceptive methods in which permanently they will prevent the pregnancy by sterilization. So the sterilization can be done in both the male and the female individuals. So it includes surgical methods. Let's see the conventional method of contraception. Conventional method of birth control are also referred as natural or traditional methods. So in the natural or traditional methods, those are the birth control method in which they depend on the natural rhythm or function of the body. So avoid the meeting of sperm and ovum will be controlled by the natural methods. So here in this method, there will not be have any kind of side effects because it is natural only. So we will see what are the different kind of natural methods of contraception or conventional methods. First one will be called a coitus interrupter. So the first method will be coitus interrupter. So here in this method, the penis of the male will be withdrawn from the vagina of the female before the ejaculation so that they can prevent the entry of sperm into the female reproductive tract. So that fertilization will not be occurring, there will be a less chances of pregnancy. But the chances of failure of these methods are very high because due to the presence of sperm in the pre-ejaculator. So pre-ejaculate is the liquid that is produced by the seminal vesicles and other gland. So there is a chance that this pre-ejaculate will be consist of a small amount of sperm that can maybe lead to the pregnancy. The next method is called a periodic abstinence or rhythm period. So we know that the ovulation will be done on the 14th day of a 28th day menstrual cycle, in which 10th to 17th day will be very fertile. So we will be avoiding the sexual contact during the 10th to 17th period. So here the chances of fertilizations are very high during this period as ovulation will be expected. So this method has also high failure because some people will be having irregular menstrual cycle. So in those who are having irregular menstrual cycle, we can't be able to predict the ovulation date. The third method is called lactational amenorrhea. So here in the lactational amenorrhea, the absence of the menses in which when they are lactating intensively followed by the parturition. So parturition is the childbirth, it will be followed by the lactation. So during the intense lactation, so here the menses will be absent. So during this period of ovulation, the menstrual cycle will not be occurring. So it is temporary postpartum infertility which will be occurring maximum up to 2 to 6 period of months. After that, when the intense breastfeeding will be removed, it will be again occurring. So here the high chances of failures are there because of the irregular menstrual cycle of the females. The next major method is called barrier contraceptives. So here it is a mechanical or a barrier method in which the contraception will be prevented by meeting of the ovum and sperm. We will see examples. First one will be called condoms. The condoms are disposable rubber or latex sheath that is used to cover the penis in the males or vagina or the cervix in the female before copulation. So this checks the pregnancy by preventing depositions of sperm in the vagina. So it will be helping to not meeting the sperm and the ovum. Condoms have one more benefits. They will be very known to prevent the various sexually transmitted diseases, so as they prevent the semen from entering into the female body. So the transfer of sexually transmitted diseases as well as the entry of sperm can be covered. The only shortcoming of condom is that it cannot be reused. Condoms are of two types. Female condoms are there, male condoms are there. We will see about the male condom. Male condom is a thin rubber or latex sheath and has a ring on the one end. So what is the purpose means? It is used to cover the male genitalia or the penis just before the coitus to prevent the entry of ejaculate semen. Female condom. It is also referred as femidom. It is a device which will be made up of polyurethane material and it consists of two rings at both the ends. So they also prevent the meeting of sperm and ovum. The next major methods are called diaphragm, cervical cap and vault. So these are dome-shaped devices. It is made up of rubber or latex or silicone. They are used to cover the cervix during the copulation as a measure of birth control. So it is used or it is inserted just before the sexual intercourses. So this can prevent the pregnancy by checking the entry of sperm into the uterus. So cervical caps are also known as fem shield. So they are reusable devices. They can use again and again. They have higher efficiency than the other barrier contraceptive because of the usage of spermicide in them. So there are a lot of spermicide will be present. Those chemicals will kill the sperms. Next is called chemical methods. So here it helps to increase the efficiency of barrier method like vault, diaphragm, cervical cap, etc. So it includes usage of spermicidal, that substances which will kill the sperms like jellies, tablet, cream in the vagina for about 5 to 10 minutes before the sexual intercourses. So it helps to kill the sperm that will prevent the pregnancy. The next method is called intrauterine devices. The intrauterine devices are the devices which are meant to be inserted into the female reproductive tract for preventing the pregnancy. So we can prevent the contraceptions. So they are made up of either plastic materials or the metals, or it can be combined with the both. They are instead used by the doctors or experienced nurses. It cannot be able to use personally. they have higher efficiency than the other barrier contraceptive because of the usage of spermicide in them. So there are a lot of spermicide will be present. Those chemicals will kill the sperms. Next is called chemical methods. So here it helps to increase the efficiency of barrier method like vault, diaphragm, cervical cap, etc. So it include usage of spermicidal, that substances which will kill the sperms like jellies, tablet, cream in the vagina for about 5 to 10 minutes before the sexual intercourses. So it helps to kill the sperm that will prevent the pregnancy. The next method is called intrauterine devices. The intrauterine devices are the devices which are meant to be inserted into the female reproductive tract for preventing the pregnancy. So we can prevent the contraceptions. So they are made up of either plastic materials or the metals, or it can be combined with the both. They are instead used by the doctors or experienced nurses. It cannot be able to use personally. So the intrauterine devices are the most widely used methods of contraceptive in India. So when we are using means whenever we need the spacing between the children, or if they are affecting the long-term pregnancies. On the basis of this, they can be called loops, tees and a ring. So we will see what are they. Copper releasing IUD. Example copper T, copper 7, multi-load 375, etc. So here multi-load 375 can prevent pregnancy up to 5 years. So what they will do means they will be releasing copper ions which is acting as a spermicide. Next is hormonal IUD. Progestasert and LNG20. These are the hormone which will release the IUD. So here synthetic progesterone will be produced for the birth control. The hormones which is released by this IUD are responsible for making the uterus unsuitable for the implantation. So even after the zygote will be formed, the endometrium will not be proper, so that there is no implantation will be occurring. Non-medicated IUDs are also there, which will be made up of polythene and impregnated with the barium sulfate, mixed with the barium sulfate. It creates a spermicidal effect by stimulating the immune system and increasing the production of phagocytes. So it results in the killing of the sperm, and thereby we can prevent the pregnancy. So example, Lipids-Loop. It is a non-medicated type of intrauterine devices. Next is called oral pills. So the birth control pills are physiological or the oral that is used for the method of contraception that will consist of progesterone or progestrogen-estrogen combination hormones. Pills are taken orally for 21 days, in which 5 or 7 days we are taking alternatively for 3 times. It is advisable that we have to repeat that after a gap of 5 or 7 days. If the dosage is missed, it should be taken as soon as remembers, even if one has to take 2 pills at once. That is also advisable. Some will be contain steroids as well. So it will be having high effect. Non-steroidal oral contraceptive pills are available. Example, Saheli. Saheli is a birth control pill which is developed by Central Drug Research Institute by India, that is located in Lucknow. So it consists of non-steroidal preparation. So it only birth control pill that is non-hormonal. So Saheli, what they will do means it will block the estrogen receptors in the uterus and prevent the implantation. So the uterus is very essential with the estrogen during the implantation process. Another one is called implant. So implant are the structure that contain either progesterone or combination of progesterone as well as estrogen. So what we are doing means we are inserting this under the skin in fan-shaped manner. So here we are placing under the skin and release the hormones in the blood. So it is having same method as the oral pill will be doing. So they don't have much longer effective period. So they will be releasing the hormones that make the uterus unsuitable for the implantation. Implantation is the attachment of the zygote or the developing embryo after egg-celled stage in the endometrium. And also they will prevent ovulation. So it is also effective for the 5 years. So it do have great effectiveness, and also some negative effect will be there, that is called irregular bleeding. So last method will be called surgical methods of contraception. So the surgical methods of birth control are also present in male as well as female. It is otherwise called sterilization techniques. So they are usually irreversible. Once it is done, there is no coming back. So methods are highly effective with a 100% success rate. So we will see in male, the sterilization method is called a vasectomy. So it involves cutting and removal of a piece or tying up of a vas deferens through a small incision that is made through the scrotum. Scrotum is the muscular bag-like structure that will cover the testis. So this technique prevents the transfer of sperm from the testis to the semen via vas deferens. So it will block the transfer of male gamete also. Tubectomy. So it is a female sterilization method. So here what we are doing means tying or removing a piece of fallopian tube through a small incision, which will be done through the abdomen, or we can done through the vaginal opening. So what it do means, it will prevent the fertilization by preventing the transport of the ovum.